Welcome. I am Christina Lombardi. I'm the owner of Functional Nutrition RX, which is a group private practice for nutrition counseling. And Rachel is here, who will be speaking briefly and introducing herself, but she is the owner of Lotus Physical Therapy, which specializes in pelvic floor physical therapy. And today we're going to be talking about gut health and pelvic floor function and how they intertwine together. And I'm going to be going a little bit more in depth about gut health and what we can do to help optimize it. Rachel, are you able to get your slides up?
Oh my gosh, sorry, I was talking and you guys couldn't hear me. Yes, I'm all set. Let me just share my screen here. I'm excited to see all of you guys. Here, let's see. Allow. All right, can you guys see that?
Yes.
Okay. All right. So we're going to talk today about the connection between our pelvic health and our gut health. And a lot of people, we hear the term pelvic floor or pelvic health, and we don't really know what that is. So I'm going to give you an introduction, and then we can answer some questions at the end, okay? Okay. So why does this matter? Our core and our pelvic floor help to support our digestion. So later, Christina is going to talk a little bit more specifically about gut health. And why do we have to focus on our pelvic floor health also? In order for our digestion to work the way that we need it to work, we have to have strong core and we have to have strong pelvic floor. And we have to have flexibility in our pelvic floor like we would in any other muscle, because that's part of the function of our pelvic floor is to open and let things out, but also to have the strength to keep things in. Okay, and our pelvic health and our gut health really do go hand in hand. So, what is the pelvic floor? The pelvic floor refers to the muscles in the base of the pelvis. So, if you look at this photo on the left here, you can see that the base of our pelvis has three layers of muscles. And you can see how they're connected from the tailbone to the pubic bone. And just because these muscles are in this particular area, so it's such a private area, right? Like we don't talk about this area. These muscles act like any other muscle in your body. So just like your quad, like your bicep, like your hamstring, these muscles can have strength, flexibility, trigger point, tightness, tension. And so, because it's in this area, a lot of times people are like, who do I see for this? You go to the gynecologist, they don't really know how to treat the muscles. You go to your GI doctor or your colorectal, and they maybe may or may not know how the pelvic floor is related. But really, the pelvic floor therapists are the specialists in this area because we specialize in musculoskeletal, and this particular area is part of what we can treat. So if you can see, there's some of those deeper muscles that come out into the hip. So our pelvic floor is related to our core. So if you look at that this photo here on the right, if you look at that photo, you can see the diaphragm, you can see your abdominals, the pelvic floor, and the low back. So if I said to you, what kind of core exercises do you do? Most people would say, oh, I do some crunches, I do some planks, I do some sit-ups. But our true core is also related to our diaphragm, so our breathing, our lower back, and our abdominal muscles along with the pelvic floor muscles. So they work together as a canister. There's a top and a bottom and muscles that go all the way around. So how does that relate to our gut health? We need our abdominals, our pelvic floor, and our back to be strong to be able to support all the organs that are in our abdomen. So we have such important organs in our abdomen, right? We have our intestines, our stomach, we have our uterus, we have our bladders, we have our rectum, our colon. So we have such important organs in that in our abdomen that we need the support system to be nice and strong, right? So when we inhale, these muscles open up and lengthen, and when we exhale, these muscles shorten and contract, right? And that all has to work as a system. So if you've been pregnant, if you've had a C-section, if you've had abdominal surgery, pelvic surgery, any scar tissue, if you have a history of endometriosis, adenomyosis, that can all play a role on how your muscles will then support your digestive tract. Right, so the functions of the pelvic floor include urinary, bowel, sexual, and birthing. So for urinary function, I know we're kind of digressing a little, but I just wanted to paint a good whole picture for you. So for urinary function, any dysfunction in your pelvic floor system would include urinary leaking. So cough, laugh, sneeze, exercise, jumping jacks, running. You're leaking urine when you don't want to leak urine. Urgency would be you have to pee, you feel like you have to pee, and then you can't make it to the toilet, and then you're leaking a little bit then, and then you really have to go at that moment. So sometimes people will say, when I get the urge to urinate, I have to go that minute, otherwise I won't be able to hold it in. Okay. So that's urgency. We call it key in the door. Like sometimes you put the key in the door and you're like, oh my God, and you're doing the dance where you're crossing your legs and trying to keep it in. So we call that key in the door syndrome. Frequency would be going every 15, 20 minutes. So the adult human bladder should be able to hold about 20 to 30 minutes of urine. Sorry, not 20 to 30, sorry, 2 to 3 hours, 2 to 3 hours. So if you're going to the bathroom every 15 minutes, every 20 minutes, or even every 30 minutes, that's a lot. Unless you're drinking an incredible amount of water, you really should be able to hold your urine about 2 hours if for an adult. Waking up to urinate, this is a popular one. A lot of people, as we age, we start to wake up a couple of times in the middle of the night to urinate. So if you urinate right before you go to bed and you sleep about 5 to 6 hours, 7 hours, you should be able to hold it till the morning. That's normal function. To get up one time a night, that's still within normal range. But if you're getting up 2, 3, 4 times a night to urinate at night, that's not normal function. So it could be something going on with your muscles. Incomplete voiding would be peeing, and then you stand up and you dribble a little bit leaks out. Or you put your underwear on, you start to walk around, and then a little bit of urine leaks out again. So that would be incomplete voiding, and that's because the pelvic floor muscles get very tight. And any pain, none of these urinary bowel sexual function should ever give you pain. So if you're urinating and you have pain, if you have pain after urination, that's also not normal function. It could be that there's weakness in the tissue, weakness in the muscle, spasm in the muscle. So that's what could be happening with any of these. For bowel function, so just like we can have urinary incontinence, we could also have fecal incontinence. So it's not as common or it's not as reported as much as urinary incontinence. When we think about pelvic floor, a lot of people think mostly the urinary issues, but we do see many people who have fecal incontinence, which means that they're staining their underwear. There's a little bit of feces coming out either when they feel like they have to go to the bathroom or afterwards. And that's not normal function, right? We don't want to be walking around having to worry about wearing a pad, wearing a diaper, like that type of thing. If that's an issue, sometimes it could be from any surgery that you might have had in that area. Women who have had babies and had an episiotomy where they get, or a tear during birth, when they tear or get an episiotomy down to the anus, sometimes there's scar tissue there, and then the muscles are not able to stretch and be able to accommodate, going to the bathroom. So then it tightens up prematurely, and then a little bit of feces gets stuck in the muscle. And so then we end up staining our underwear. And we also get fecal incontinence if we have digestive issues and have diarrhea or loose stool, which Christina will go over in a little bit. Constipation and straining. When you sit to go to the toilet, you should be, if you feel it and you feel the urge, you should be able to sit. go to the bathroom nice and easily without straining, without pushing, and without pain. So if you're someone that's sitting on the toilet for 20 to 30 minutes, scrolling on your phone, waiting for things to come out, that's also a bowel dysfunction, right? So we should be able to sit, go, everything should come out. Sometimes people will say, oh, I go and I feel like a little piece gets stuck behind. That should not be. You should be able to go all at one time and not have to sit there and wait for that last piece to come out. Sometimes the muscles will then contract prematurely and almost like cut it off, cut off the feces a little bit, and then a little bit gets stuck right at the end, and then you're uncomfortable for the whole rest of the day. And pain, we should not have pain. If we're going to the bathroom, it shouldn't hurt when it's coming out. It shouldn't hurt afterwards. A lot of people will say that they feel spasming in their anus after they move their bowels. And that's all of a function. That's because the pelvic floor muscles are tight. So we recommend using a squatty potty or a footstool. Um, the squatty potty has become very popular. The only reason why I don't love it is because it sits around your toilet and it has to stay there. It's sort of like it's not a big piece of equipment, but it does stay and sits around your toilet. Amazon has these collapsible, foldable footstools. I like those a little bit better because then you can fold it up, put it on the side and just take it out when you need it. For anyone that has little kids at home, you can use that little bench that they use to step on and wash their hands. Anything that you can use to put your feet up just changes the angle of your pelvis so that when you have a bowel movement, everything comes out nice and easily. So highly recommend that. And again, Christina will go over diet and gut health. And when we're eating well and when our digestive system is working the way that it should work, there shouldn't be diarrhea constantly through the day. Constipation, normal bowel function is that you go 1 to 2 times a day. Sometimes three, people sometimes go 3 times a day, as long as it's a nice solid stool and not liquid, not diarrhea, not pellets. So you also don't want the opposite. You don't want pellets either. So if you have pellet poops, we call them, that means that maybe you're not hydrating enough, right? So you want one long piece that comes out nice and easily with no pain. Okay, sexual health. Sex should never hurt. So if we have pain with any sexual activity, whether it's intercourse or manual stimulation, there should be no pain either during or after. Sometimes people will say, like, oh, after I, orgasm or after I have sexual activity, I feel like throbbing or I feel pain afterwards. That's not normal function. Decreased sensation, we get this in the postpartum phase and we get this in the perimenopause, menopause phase where things just don't feel the same. We don't have the same sensation. Things don't feel as good as they used to. Persistent genital arousal disorder. This is not very common, but it does happen. Basically, the pelvic floor muscles continue to spasm throughout the day, and basically women are orgasming all day long. And sometimes people will be like, "Oh, what's wrong with that?" But it does become very disruptive to your day if you're constantly getting that spasm, in your pelvic floor. And then vaginal dryness from hormonal changes. So again, postpartum and perimenopause, the hormonal shifts are very, very similar. So, a postpartum mom will have vaginal dryness, pain with intercourse, pain with sitting, pain with riding a bike, pain with exercise in her pelvic floor. A lot of times it's because there's vaginal dryness from the hormonal change, and a lot of those changes are very similar to what goes on in perimenopause. And how does our pelvic floor work? So if you think of a trampoline, right, that's sitting there at rest. So there are no kids jumping on it. It's just sort of like at rest. There's tension in the muscle, but it's resting. And then you throw a bunch of kids on and they start jumping on that trampoline. The trampoline will stretch, right? So the pelvic, just like the pelvic floor, has to stretch and have flexibility, but it will have the strength to come back up to resting position. So that's what our pelvic floor should do. So when we cough, when we laugh, when we sneeze, when we exercise, when we urinate, when we have bowel movements. The pelvic floor muscle should have flexibility to open up and let things and accommodate that intra-abdominal pressure, but it should also have the strength to come back to normal position. And when it doesn't have that flexibility, that's where we can have some dysfunction, like those things that I listed before. Okay. So diastasis recti, most people will relate this to pregnancy. But I will also say that if you're someone that has a job where you're lifting heavy weight, or you just have a lot of lifting in your job, or you're someone who goes to the gym and does a lot of heavy lifting with dumbbells and weights, um, we can get what's called diastasis recti. So diastasis means separation. Recti means refers to the two rectus muscles. So if you look at this photo here, so we call them the six-pack muscles, right? So these two muscles side by side are called the rectus abdominis. In someone who does not have a separation, they're pretty close together, as you can see. The weakest point of this of the abdomen is right by the belly button, just because of the way the tissue is situated. It's sort of like in the spiral. It's the weakest point. During pregnancy, and during any sort of job where you're lifting or lifting at the gym, sometimes there could be pressure right around right around the umbilicus or the belly button, and that tissue between the two muscles will then stretch, right? What we don't want is for that separation to stay that way. We want the two muscles to be as close together. So postpartum, we train our women, we give them exercises to help bring those muscles back together. Because if you look back at this photo, we need our abdominals to be strong, to be able to support our pelvic floor and our lower back and all of the organs that are inside. So if we have this separation here, we're not able to support the organs underneath. So people who have diastasis actually have very slow digestion because you don't have the muscle strength to support the intestines and the stomach behind it. So it's very important that if you're somebody who has had, and even if you've had your babies, 15, 20, 25, 30 years ago, if you never were checked for diastasis, you can still get checked and you can still do exercises to help bring that separation back together. So people who also, so the tissue here will stretch. If it tears, sometimes people will get what's called an umbilical hernia. So what that means is that the organs behind the umbilicus or behind the belly button will then push through that hole, that separation. And so if you can imagine that the intestines are right behind that abdominal wall, if it's supposed to be in a certain fashion and now part of it is sticking out, the digestion won't work the way that it's supposed to work, right? So a lot of times people will get that hernia. Oh, someone has a question.
Can men get that too?
Yes. Yes.
Because my husband has an umbilical hernia,
Uh-huh.
and I'm wondering if he has that too.
So if he has an umbilical hernia, most likely he has an abdominal separation. Does he have a job where he lifts a lot? Yeah. So, it's funny, they don't really check it in men. They check it a lot in women postpartum, but men can have diastasis, babies can have diastasis, but in babies, it resolves itself on its own. But for adults, you have to do specific exercises to bring that back, to bring the muscles back together. And the reason for that, not only do we want to support our back, right, and not have back pain. So when you have that hole, when you have that separation there, it will affect your back, but also for your digestion, right? So then it slows up your digestion. Things don't move through the system the way that they have to move. So now you're not pooping every day. Now maybe you're constipated and you're moving your bowels every 2 to 3 days, right? So that's not normal function for our bodies because it's a way to detox, right? Having a bowel movement is a way that we detox our body every day. So if we don't have that system in place and that support in place, it can cause constipation. It can cause, pain with digestion. So, um, After today, I'll send out like a little like a summary with some exercises. You're more than welcome to share it with your husband if he needs. So, right, so our abdominal muscles will support digestion, and when the core is not strong, that's when we get bloating and slow motility. So practical tools. So some things that you can do after today, diaphragmatic breathing. I'm sure, if you've taken a yoga class or a Pilates class, you've heard of this. So diaphragmatic breathing is when we breathe in through our nose, we expand our belly, ribs, and chest. We call it 360 breathing. So you're breathing into your abdomen and then you exhale, drawing your belly button to your spine, nice and slow. So if you take 5 seconds to inhale, it's 5 seconds to exhale. And you do this for relaxation, but you also do this when you're lifting. So if you're lifting, you inhale before you grab the thing that you're lifting, and then you exhale as you lift and come up, right? So you want to incorporate that into your day. So that means laundry basket, that means grocery bags on the floor, that means if you're picking up things off the floor, you inhale when you bend down, you exhale when you come up. And most importantly, during our bowel movements, right? So a lot of people will hold their breath and strain when they're pushing out. The best thing you can do is to inhale into your abdomen and then exhale as you draw your belly button to your spine with your feet up on your little stool. That's the easiest way to move your bowels. Safe core strengthening. So if you see these exercises on the bottom, most people will think sit-ups and crunches for core strengthening. But when we do them in a safer way, we avoid having that separation in our abdomen, and it's a more controlled exercise. So laying on your back and doing some marches like this, you can put ankle weights, you can put a resistance band to make it harder, but this is a good start. And then it kind of gets movement into the intestine, into the lower colon. So if you're someone that suffers from constipation, this is a good exercise to do. We have bridges. And again, with bridges, you can put weights on your hips. You can put a resistance band here to make it harder. This is a bird dog where you have opposite arm, opposite leg, and you balance for 10 seconds and then you switch to the other side. This strengthens your lower back as well as your core. And then standing marches. So standing is harder than laying down on your back. So if you're standing, you could do this marching this way. And just move your body every day, walking, rebounding, vibration plate, all of that will also help your digestion. All right. So just to bring some light to C-section moms, um, when we have a C-section, the doctor's cutting through abdominal muscle, tissue, fascia. Um, and sometimes we can have scar tissue or adhesion, which then limits the mobility in your abdomen, right? So we want everything to move nice and freely. So if you've had a C-section, I would definitely do massage, check it out, see if there's any tightness on the lateral edges of the scar, sometimes in the middle. Sometimes people will talk about that shelf that they have from a C-section. If you have that little bump or that little shelf, that most likely means that there's some scar tissue or adhesion underneath the C-section. So we always recommend massage or cupping to help get mobility back in that scar. So scar management is really important. We talk about this a lot in our practice to make sure that everything is moving nice and easily. You don't want pain. You don't want any kind of tightness. And I always feel so strongly about this, Christina, and I talk about this. I think it's so important for us to normalize talking about our pelvic health. And I think it starts with our younger generation. They need to learn about their puberty, about their changes. And then again, in prenatal postpartum phase, we need proper sex education in schools, and we need the communication to happen at home so that we're not in our 40s and 50s having this dysfunction and then we have nobody to talk to about it, right? Because a lot of times the doctors will just say, oh, this is normal. This is what happens. Drink more water, right? Like that seems to be the answer to everything. Have a glass of wine, which actually makes things worse. So I urge you to please talk about this stuff with your kids, with your grandkids. And if you have issues and your doctors are not listening to you, you have to find the person that will listen to you and help you. The doctors only have 10 or 15 minutes to spend with you. So if they can't answer your question, a lot of times they'll just say, well, that's just what happens when we age, or that's just what happens after having kids. That's not an appropriate answer. So please, look for people like Christina, like me, that will be able to answer you and at least guide you to the right person. And that's it for me. So I'm going to hand it over to Christina.
I was muted.
That's okay.
Okay, awesome. So, I see a chat question maybe. Oh, someone said thank you. Okay, perfect. Okay. So I'm going to be speaking a little bit more about the relation between gut health and the pelvic floor, and then going more into specific gut health stuff. So the body doesn't operate in departments, right? Every organ system and tissue is constantly communicating, like you can see by this picture I have here. Actually, sorry, I'm just trying to, I just want to be able to see everybody too while I talk. All right, I can't figure it out. Just someone talk. If you have a question or anything, just talk because I can't see anybody anymore. So the gut dysfunction can create downstream effects on the pelvic floor, and the pelvic floor dysfunction can create downstream effects on the gut. It's a two-way street, and it's just everything's all connected, as you can see through this picture. And going a little bit further, as functional dietitians here in my practice, we look at the body as a system that works together. Your nervous system and your digestive system are constantly speaking to one another. For example, the HPA axis, which is a hypothalamic pituitary adrenal axis, and you could think of it as your stress command center, is a place where you could see chronic stress kind of building up and causing it to be in overdrive, which will then affect your digestion, hormone balance, and even tension within your pelvic floor muscles. There's
Let's go.
also,
We're going. Then get rid of them.
we can hear
Well,
someone
then get
is
rid of them.
unmuted.
Then turn off, hang up the phone.
Are you able to, who's talking?
I'm leaving.
Hold on, you got him? Okay. So the brain gut axis is another way that the body connects together. The gut sends signals to your brain, and the brain responds to what's happening in your gut. Also, the brain will tell the gut what's going on. So if you have a lot of, say, anxiety in one day, that can cause constipation. It can cause inflammation. It can worsen your mood, and create just more pain sensitivity. Pelvic floor dysfunction can be something that reflects what's happening across the entire pelvic cavity and digestion. So there's overlapping symptoms like constipation, bloating, pelvic pain, low back pressure, which you can see because of what Rachel was showing us with that picture with the body and the back and the abdomens. These are all clues that something might not be working together. And it's helpful to ensure diet and lifestyle support go hand in hand when you're even looking at pelvic floor therapy. So looking a little deeper, digestive symptoms and chronic pelvic pain and how they're linked to thoroughly. One is just the fact that they're in close proximity in the body. This is our abdominal cavity. You can see the bladder, a uterus, rectum, pelvic floor muscles, all are within the same space. So perhaps when one structure is inflamed, swollen, or even irritated, neighboring structures can be affected by that. Another reason why they're heavily linked together is that nerves will cross-talk between pelvic organs and in that cavity. So there's overlapping nerve pathways. Inflammation, again, as I mentioned, in one organ can trigger pain response in another, even without a direct injury. And this was actually shown in studies. They saw that an acute inflammation in, say, the colon, bladder, or uterus produced signs of inflammation in another uninflamed organ. So this is super important because perhaps calming the gut or something going on in the pelvic floor, vice versa, can help each other. going a little bit more into the gut and constipation and gut dysfunction in general, it's always important to normalize talking about poop. We do it a lot here in practice. We always want to know what our clients' poop is like. It is a very important clinical indicator of your gut health and your pelvic floor health as well. So as Rachel mentioned, we want 1 to 3 painless, easy to move, past bowel movements per day, not once every 3 days, which some people might think is normal. And even if you have a bowel movement every day, that still could be, you still could be constipated, because then we also want to look at the type of stool. Should be in this Bristol stool chart of types 3 to 4, which are smooth formed, easy to pass. Like Rachel said, type 1, more pellets. If you have those, but you're having a bowel movement every day, I would consider that constipated. So to go a little bit in depth about root drivers of constipation and in general gut dysfunction, some common drivers include lack of movement. A sedentary lifestyle will slow gut motility and mobility. So when I say gut motility, I'm talking about how food and bacteria and everything kind of moves through your gut. It should be moving pretty well. So I think of, so just that motility kind of interchange. Walking for 10 to 20 minutes after a large meal can significantly help with your gut motility. Also, hydration. A lot of things we see in practice are clients not consuming enough water and fluids. It's important to note that your colon actually does pull water out of the stool. So it's very important to have a good baseline hydration. I like to recommend for typical person, half your body weight in ounces of water per day. So that's an easy calculation to do. Thinking about fiber. So some people say, well, when I eat more fiber, my constipation gets worse. That most likely is a motility issue and not a fiber concern. So we would want to look deeper as to what's going on, why you're not feeling good with the fiber, and address it that way. And also a very low carbohydrate diet might not provide enough fiber that I recommend, which is 35 grams per day. It's important to also talk about stress and being in that fight or flight mode. Chronic stress will put us into fight or flight, which then does not prioritize digestion when you're in like a survival mode situation. That will make your stomach acid drop. It'll make your digestive enzymes decrease, and gut motility will slow down drastically. It also can cause a too tight pelvic floor, which will make it physically difficult to relax and have a bowel movement, which Rachel touched upon as well. Something that I think is huge as well is looking at digestive and microbiome imbalances. So when I'm talking about digestion, I'm talking about, are you breaking down the food that you're eating? Are you absorbing it? And then are you eliminating it? There's a lot of things that can disrupt that. Low stomach acid is a big one that happens a lot in practice that we see. So without enough stomach acid, you will not be breaking down your protein properly, and it can just cause a whole big mess of downstream effects in digestion. Low digestive enzymes will also mean that food's not broken down and can get fermented by the bacteria in your gut, causing more bloating, constipation, things like that. And microbiome dysbiosis will directly disrupt your motility signaling as well. We want to make sure that you have the good bacteria. This is a little snippet of a functional stool test that we do, which gives us a lot of insight on the person that's taking it and like what's actually going on in their gut. Like, how is their digestion looking? Is there any inflammation? How is the good bacteria looking? So it's very helpful if that could be something that you might be interested in doing. Where are we on time? Okay. So things that can alter our bacteria, our microbiome is shaped by everything. So how you were born, what you are eating, medications you've taken, even what you're eating today. It's very responsive to change. Some key things that I like to point out is antibiotic use. I specialize in GI conditions. So a lot of my clients that come in that have like this debilitating GI symptoms that are affecting their day-to-day life, I see a lot of them having a lot of antibiotic use or even like NSAID and different pain management medications that are affecting that, and that can even from childhood, that can disrupt your gut microbiome all the way through adulthood. C-sections are another one. You don't get the exposure to the vaginal and gut microbiome microbes when you pass through the birth canal. Also, a high animal protein and dairy diet likely you'll not have enough plant diversity to get those anti-inflammatory bacteria species. So there's a lot of different things that can play a role here. IBS, so important to note, IBS is the #1 GI condition globally, yet it's often treated as like a catch-all diagnosis without really looking at the root cause. I think of it as more of a symptom diagnosis, like you have all these symptoms, nothing is to cause them, so we're going to label it as IBS. But it is shown in research that it is linked to altered gut dysbiosis. So gut dysbiosis is poor ratio good to bad bacteria. SIBO is a big one that can cause IBS, which is small intestinal bacterial overgrowth, something that we work with in practice and can help identify. And then it's interesting to note endometriosis, interstitial cystitis, pelvic floor muscle pain, all commonly co-occur with IBS, which could be connected back to that shared nerve, the immune function, and inflammatory pathways. So what should I do? We're talking about all this stuff and like, how can we put some things into practice? I like to look at our gut and kind of like a general framework as like a 5-step approach. So I'm going to talk about a couple of these things and some things that you can potentially implement yourself, or maybe work with your dietitian that you're seeing now, or maybe see a dietitian to help you. So step 1 is a big one. This is our detective work, identifying what is driving the dysfunction. So for some people, this may involve trying an elimination diet. It may involve going deeper with that functional stool test to kind of see what's going on inside your gut, evaluating for toxic exposures and your toxic burden. You know, are you exposed to mold, which is a big one on Long Island, in your home or even in your workplace? And just thinking about chronic stress, because stress is a big root driver for gut and pelvic floor dysfunction. So this is a piece where you might want to work with a professional to kind of have someone fine tune and look into what could potentially be a cause of your dysfunction, or maybe you feel well and maybe you just want to move forward with like supporting your gut, which would then be going forward. So step 2 is rebuilding digestive capacity. This is through digestive enzymes, bitters, motility support. It's basically helping your body do what it's supposed to do and supporting everything working properly. Here, we're going to aim again for that 35 grams of fiber per day, ideally through whole food sources. So going a little bit more in depth with this, some things that you can take away and do right away is to, for example, do things that help increase motility. And this is super important for anyone. If you know someone on GLP-1 medication or you're on a GLP-1 medication, the way the GLP-1s work is they are supposed to slow down motility. So activating it and getting things moving is super important. And just for general gut health. So lemon water in the morning and before meals is something that can help stimulate your digestive juices and your stomach acid, which will help prime your body to get ready to eat. I don't know why this keeps moving. Spacing your meals 4 to 5 hours apart will allow the body, the digestive system that's in place to kind of clear everything out and pass things through. Again, sitting in a relaxed environment, pausing before you eat, chewing your food. A lot of people are on the go or working through lunch. Maybe if that's you, starting with just 1 meal a day where you can sit and relax for 20 minutes and just focus on your food. It'll make a big difference. Digestive bitters are basically nature's digestive enzymes, right? So these are things you can add in that are a whole food approach to help, again, with digestion. So you would eat these before your meal. So if you are maybe have a salad before your full meal, including arugula in it, would be something great. Endive, which is one of my favorite. You can kind of like chew on those as you're cooking your meal or using them as like a dip with hummus. Fennel seeds, some people like to just chew on while they're cooking meals, and that helps, again, improve digestion. So step 3, we want to promote an environment for your good bacteria to flourish. When our good bacteria are flourishing, they're going to push out bad bacteria, which is what we want. We don't want the bad bacteria to kind of like be pushing out the good bacteria. So we can think of our gut like a garden, right? So our probiotics are the seeds, the prebiotics are the soil and the water. Without a fertile soil, our garden's not going to grow. So we want to make sure we have all this together. And this is the piece that some people don't think about when they're just taking a probiotic supplement. So prebiotics are the foods that will feed your bacteria. So that's why they're very important. And diversity does matter. So eating a wide variety of these prebiotic rich foods that I have listed, like the garlic, the onion, asparagus, oats, they will feed different different bacteria species in your gut. So my suggestion is to, if you're not eating any of these foods, just start with one different food per day as a starting point and then continue to increase over time. And I will say that the sunchokes are something interesting because I actually did have them at a restaurant once and they were very good. They're kind of like a root vegetable, but I was looking in this presentation to see where you could buy them at the store and I couldn't find them in the store, but I just thought it was something interesting to note. Fermented foods, they deliver live cultures to build our good bacteria. So these are some of them. The sauerkraut, the olives, the pickles, all that stuff is great. And you can supplement with a probiotic. I usually recommend speaking with your registered dietitian or a professional that's well-versed in it to see what specific strain might benefit you. And as with our prebiotics, similar with the probiotics, you want to start small and work your way up if you're not consuming them, just to see how your body reacts. And just working on consistency as opposed to overdoing it. Okay, someone just mentioned that the artichokes, Whole Foods sometimes has them, or Fresh Direct. Oh, good to know. All right, so step 4. So we're gonna want to support healing and optimizing our gut lining. So anytime, even after like an antibiotic treatment or anything like that, or anything that disrupts your gut, a food poisoning, we want to think about healing and optimizing your gut lining and kind of reducing the inflammation. So the gut lining is so basically we can think of our gut lining as like the protection of the things that you eat and the bacteria in your gut from the rest of your body. We want it to be strong. If it's not strong, things that aren't supposed to be passing through will pass through and heighten your immune system. It'll cause an immune response, even if like you're not fully digesting your protein and a larger molecule of protein is kind of passing through your gut wall. The body's going to see that as an invader and go after it, and you'll feel the effects. So we want to make sure our gut lining is nice and strong and not inflamed. And this also will have an effect on chronic pelvic pain, which sometimes can be thought of something with pelvic floor issues, but perhaps maybe it's more of inflammation in the gut lining. So here we want to talk about anti-inflammatory foods. I'm going to send you guys a handout with more in depth of anti-inflammatory foods and how you can incorporate them into your day-to-day, but always the fatty fish, salmon, if you're a fan of sardines, those are great. Any colorful vegetable, thinking of eating the rainbow, which sounds generic, but it's really a great way to think about it. Extra virgin olive oil is great, turmeric, curcumin, all that fun stuff. Supplementation, that could be good for most people. Vitamin D, it's critical for your gut lining and also it helps immune regulation in general in the body. And L-glutamine is a great supplement that you could take as well that kind of helps with healing the gut wall and promoting a strong gut lining. And then finally, thinking about like rebalancing the body, it's important to also pay attention to our lifestyle choices and not just our diet. So chronic stress is a biochemical event. It raises our cortisol, which then impairs our stomach acid, our digestive enzymes, and can create a like tight pelvic floor. Sleep deprivation can disrupt your gut bacteria within days, and it can raise your cortisol levels, which will also slow down motility. So all these things come together. Regular exercise and movement and walking will help motility of the gut. It'll help your rest and digest hormones and help you feel better. So going a little bit more into this rebalance, step 5, scheduling self-care, slowing down at your meals, having stress reduction practices are all very important. A lot of times with my clients, like these little things like shift the needle a lot more in relation to everything else that they're doing. Again, exercise, meditation, breath work is all super helpful. It'll help lower your cortisol levels, calm down that HPA axis that I mentioned earlier in the presentation, and just get you into that rest and digest state. And then, as always, if you need psychotherapy or a therapist, that's always something to look into. And we have a lot of referrals that we work with as well. A little bit more about self-care, myofascial release, which I believe Rachel probably also does in her practice. We do a stretch class for that here at the gym on Saturdays. Lymphatic support is really important. All this helps with reducing tissue tension and improving fluid dynamics in the body. I like dry brushing for lymphatic support daily at home as well. Nervous system regulation, again, the breath work, cold exposure, just kind of getting your body to think that it's safe is really important. Warm baths, essential oil use I love, like lavender oil, and again, the breath work. So in conclusion, this is kind of like my framework as a roadmap for you guys. It's important to note that every step that I mentioned is built on the one before. And this isn't like a linear one-size-fits-all path, kind of taking into effect your clinical picture, history, and like root causes can determine where you might want to start here and what you want to prioritize. So I always encourage seeing one of us here in the practice to help you, even if it's like a one-time, like almost like your yearly physical with a doctor, like a yearly like health check with your dietitian. And also I feel like that would be good for a pelvic floor therapist as well. So that's that. Again, I'm Christina with Functional Nutrition and Rachel with Lotus. Does anyone have any questions? All right, no questions. If you think of anything, feel free to reach out to us, but I will be sending this recording out and the slides, and we, like Rachel said, we have a couple things that bonuses that we'll include in the email as well. All right, thank you, everybody. Hope you have a great day.
Thanks, everyone.